Now we're going to talk about aging backwards a little bit differently, aging with confidence, she called it. In her description of her breakout, she said, aging is a privilege and embracing it with confidence is a game changer. The privilege part I'm having a really hard time with as I'm like stuck in the middle of this feeling older thing, but I think one of the privileges I feel of having her here to talk today is to answer some questions that maybe you would be too afraid to make an appointment to ask. And so I kind of feel the same way with the Iowa Women's Health Center people. So I'm going to welcome Madelyn Pilcher, is that correct, to the stage. And
I was going to offer to do it earlier. I wasn't okay with it.
Well, no, I was just like, what the heck? I knew who I was looking at.
Yeah, no worries. It just would have been very awkward coming up earlier and talking about that when it's various different subjects. Hello, everyone. I'm Dr. Madelyn Pilcher. I'm the clinical director at Innovative Aesthetics. We are going to talk about aging with confidence. There's going to be a little bit more speechy at the beginning, and then we're going to get into pictures and more fun stuff at the end, or in the middle. So we've all seen what it looks like to age with confidence out in the world. Yeah, wait, this next one's a good one. Oh, yeah, it's good. So obviously, you know, we look at these women, some of them in their 50s, others all the way up into their, 85 years old. And the good, the bad, the ugly, it doesn't need to be that extreme. All of these treatments are, some of them look really nice, some of them have been reversed. We've seen changes in these women that I've listed who have done a lot of work and then went back and had a lot of work taken off. So today we're going to, oh yes, and I said, are these changes practical and are they affordable? Some of this is very expensive. Some of it is you have to go under the knife to get it done. And a lot of people don't want to do that. So today, basically what I'm going to do is we're going to talk about the aging process and the different concerns that we all have as we begin to age. There's crazy things being done in the aesthetic world, but there's also amazing things that are being done in the aesthetic world that can truly slow the process of aging, okay? So our common concerns are wrinkles, brown spots, vascularities, you know, those little vessels that we start seeing, finding a home on our legs or on our cheeks that we never had before. I love that when clients will come in and say, but I never had this red spot. Uh-huh. Right? Okay, uh-huh. So it's skin laxity, thinning hair, and then the lovely new hair. I think everyone can remember that one time, or maybe not everyone, there are some younger people here, where they looked in the mirror and they were like, what in the world is this, you know? It happens to everyone, and that's what I tell my clients, this is normal, we all go through it, it's a process, we're here to help, okay? As I saw on the bottom, this process actually starts at age 30. I know a lot of us at age 30 thought we were young, beautiful, vibrant, everything. And then it just slowly kind of faded down towards our 40s, and then a little bit more by 45, and then by 50, we're looking in the mirror going, okay. So by 30, you're actually starting to lose 1 to 1.5% of your collagen. So that's actually when you start to age. By age 40, with perimenopause, that starts at age 35, technically, on average, we're seeing that depletion increase rapidly. So that's why there is a big difference when you look at individuals and you see their faces and you think, well, that person could be 50, or they could be 70, or unfortunately, they could be 40. And so there is that huge span that it's like, where do we fall? What can we do to make ourselves look the best we can look and, quote, age with confidence, okay? So what can we do? The number one thing we can do is protect and prevent, okay? The number one thing, the cheapest thing is that you're going to wear your sunscreen every day. You're going to wear protective clothes out in the sun. You're going to wear hats. You're going to, and we're going to talk a little bit more about skincare, but you're going to wash your face every day because you got to get that makeup and those environmental hazards off your face so that you stop the aging process, okay? Honestly, and then protect and prevent. Our diets have a huge effect on our skin, okay? So getting that really good gut healthy diet, you'll hear it from your primary care doctors, your dermatologists, your gynecologists, everyone. Trying to get that healthy gut is going to improve the color, the texture, and everything about your skin, okay? It all moves from the inwards out. And then getting rid of those vices. We all have them. I have plenty. Stopping smoking, tanning, being outside, loving the sun. Yeah, I love the sun. I just got back from Florida. It's really hard for me not to be outside. But really doing things that's going to help prevent that aging process on the front end versus coming to see me on the back end and saying, what do I do? That's the biggest thing. All right, so then I like this picture. This is a fabulous picture of aging. This is a truck driver who obviously aged on the left side of his face because he was a truck driver. And on the right side of his face, that faced the inside of his truck, so he didn't age as much. That's just sun damage. Probably smoking, maybe. But a lot of just sun damage onto that left side of the face. So wearing sunscreen, wearing protective clothing is just a good starting point to preventing this aging process. Look, skincare. Number one thing, daily sunscreen, okay? Every single day putting on sunscreen. Super easy. It's gonna protect you from both blue light, oftentimes, and the sunlight, okay? So whether you're inside with the lights above us, I don't know if anyone saw the Drew Barrymore when she found out that her lights in her studio were causing her skin damage, and she was like, what? And she walks off the stage. That's pretty much, it's everywhere, okay? So making sure you're wearing sun protection. Again, washing your face. Yes, I wrote twice a day. I don't wash my face twice a day. I'm lucky to get my teeth brushed and deodorant on in the morning, but I sure as heck will wash it at night, okay? Getting your makeup off, getting your face clean, getting those environmental hazards off your face is going to help prevent the aging process. The different ingredients that I've listed here are in commonly found anti-aging, okay? But these are the top ones that you want to look for. Vitamin E and other peptides, those are just going to help with cellular turnaround. It's going to help your skin recycle itself. It's going to keep healthier skin coming in with those topicals. Brightening agents, for those of us that have already gotten the sun damage, have already done the bad things that have caused brown spots, or maybe it's just in our genetics. Finding vitamin C, and then the natural arbutin, licorice, mulberry, kojic acid, and then there's a medication called hydroquinone, okay? Now, hydroquinone is, people have different views of that, but if you're getting it under a provider's recommendation, it does work very well for pigmented areas on your skin. Hyaluronic acid and niacinamide, or vitamin B3, that's going to help with the moisture of your skin. As you go through perimenopause, menopause, we start losing moisture barriers in our skin, and therefore our skin dries out significantly faster. That's why as we get older, we look down and we're like, I lotioned that this morning, but it looks like an old, wrinkly leg by now. Well, we lose that. So the hyaluronic acid, the niacinamide, is going to improve that barrier and keep that moisture in. Retinol and tretinoin actually help with collagen production. It saturates deeper into your system to stimulate collagen production. You're going to see an improvement with healthier collagen with those brown spots as well. So people use that for many, many reasons, but it's one, the studies basically look at the thickening of the skin by using retinol. Retinol and tretinoin also doesn't work for everyone. It can dry one person out too much and then have an opposite effect. So it's not for everyone, but it can be helpful for those that can tolerate it. Exosomes. This is new and out there and super cool in the aesthetic world, but if you haven't heard of it, it's totally okay. Exosomes are basically mRNA, okay? They're the messenger DNA between our DNA, there's little messengers, and they help build new DNA, okay? These are taken from either plants or humans, other people's, and they're derived from humans or plants, and then we put them on topically, okay? And basically, it stimulates, it has billions of growth factors that just helps our skin rehabilitate faster and stronger than it would if we were just using our natural growth hormones. Collagen supplements. Now, this is a tricky one. I get asked this all the time in my office. Do collagen supplements work? Some work. In the United States, the FDA does not regulate collagen supplements, okay? So there are a lot of them out there that are BS. I have to put it, I mean, they don't work. They have no studies behind them. They are not quality. Sometimes they have bovine byproduct in them, metals in them. So you really want to make sure that when you are looking at collagen supplements that you're getting them from a good source, a well-studied, well-recommended source for collagen supplements. But they can improve, medical term, increase the length of your telomeres, okay? So they will increase and improve your skin texture from basically the chromosomal or the DNA basis of it. And then LED light therapy. We all see those fun little lights on our Facebook when we're scrolling down and like, look at what my face can look like. Again, similar to collagen, it is dependent on what you're getting, okay? Not all of them are equal. You want to make sure that you're getting an LED light that is recommended by a medical provider or someone who has done the research to provide you with the most or the best LED light, okay? We actually carry 2 different light sources at our office because one you can walk around with and chop your vegetables with, and the other one you have to lay down with. So I like the lay down one because it's my 30 minutes of break. All right. So this is just a before and after of the brightening pads that we have using the hydroquinone. This person has melasma, which is a hormonal-based pigment. Some people will say it looks, you know, you get it when you're pregnant, you get the mustache, you get the bilateral pigment on your cheeks or maybe on your forehead or across your brow, very common places. These brightening pads are the natural, the licorice, the arbutin, the kojic acid, the vitamin C, everything's in those, as well as we added 4% of hydroquinone. And she uses these for 3 months, okay? And then we take about 3 to 4 months off, and if that pigment were to return, or if she wanted to do another trial, we'd do another 3 to 4 months with the same skin. I typically tell people with pigment, if you're gonna be out in the sun, if sun's your trigger, it's gonna come back. If you're someone that works out and heats the trigger, it's going to come back, okay? So sometimes brightening pads or brightening agents might be a lifetime thing that you just need to continue to use daily to prevent that from coming back, okay? So I went through here and kind of went through our concerns, and our first concern is the unwanted pigment or redness, whether it be freckles, whether it be seborrheic keratoses, those big, crunchy, thicker ones that we never can get rid of, that are on our foreheads or on our hands or arms. But typically, this unwanted pigment comes from sun damage, okay? Years and years. We can all say that when we were younger, we did not do the best at taking care of our skin. We used the baby oil and, you know, basking and just seeing how burned we can get. So what are we gonna do to help fix that? Believe it or not, the other thing that comes with sun damage is redness. As our skin begins to thin, we're beginning to see more redness underneath our tissue. I kind of explain it with aging. Our skin is like this when we're babies. It's really tight, it's thick. You barely can even pinch a baby's cheek because it's so thick. But when you get older, or you go up to your grandma, or go up to and you're pinching like a piece of paper between your fingers, okay? So what's happening is our collagen fibers go from basically looking very tight and plump and like this to kind of spacing out like this, okay? So those vascularities find their way to the surface, and it would be nice if they found their way back, but they don't. So anytime we drink red wine, or we go to the gym, or anything that may cause that redness overwhelming in our skin, it finds its way to the surface, but it doesn't always go back in. So it just hangs out there on the surface, and that's where you start seeing those little vascularities or overwhelming brightness or rosiness in our cheeks, okay? So these are the things that are going to help fix it. And I'm gonna go into more detail when we look at the before and afters so that you see this is what it does. So broadband light. Broadband light, or maybe you've heard of IPL, which is intermittent pulse light, okay? We carry a broadband light here because it allows us to use filters to hit different concerns in your body. So we have a 420 filter that will hit 420 that will hit bacteria on the surface. We have a 515 that will hit the pigment on the surface. We have a 560 that will go deeper and will hit the redness and deeper brown pigment. And then we have a 640 that goes even deeper, and it hits hair follicles and fibroblasts, so where our creation of the collagen comes from, okay? So we can go all the way down. When you get that one treatment, depending on what your concerns are, we're going to use all of those filters. Or if you don't have all of those concerns, we're only going to use a few of those filters. But you're going to get a full treatment for what your problem is. Then, as I mentioned before, we have that we have the skin brightening pads, but we also have a skin brightening peel. Now, for those people that don't like lasers and like that whole peeling sensation of all of their browns coming off in a big, layer of peeling skin, that's where the skin brightening peel comes in, okay? I always tell my clients, you're either a peel person or you're a laser person. And you're going to get results with each one of them. It's just how many are you going to do to get the same result, okay? The next one is a Moxie fractional laser and then a halo fractional laser. Notice the first one's a broadband light, so it's not a laser. The Moxie and the halo are fractional lasers. Those are resurfacing lasers. So those are going to be a little bit deeper than the light or the skin brightening peel. You're going into the deeper tissue, okay? And you will have downtime with both the skin brightening, the Moxie, the halo. And then we go to the pico laser. The pico laser is more for us a spot treatment. It's for those really big raised brown seborrheic keratoses. The things that when you get a peel or you do your dermabrasions don't go away. They're the big brown spots on your arms. Some people see the big black crusties on their grandparents, that are on their foreheads. That's what the pico laser is going to take care of. And you're going to see some before and afters of that as well. And then you have the clear V laser. And a clear V laser is one that's going to help vascularities on the body, the little spider veins that we all get as we begin to age. And we're going to see, again, some before and afters on that one. So this is a BBL, before and after. You can truly see, and this is just one treatment. She had a history of, obviously, a lot of brown. And so that is that. And again, the brown and improvements. Now, that second one, if you see, she's getting routine BBLs, and maybe that could be just one a year since 2014, okay? As well as using her sunscreen and skincare products. This is improvements in redness and vascularities on the skin. So if you know someone that has those, again, vascularities, and this is just one treatment in getting these improvements. There is no downtime with a BBL. A BBL is something you can do over your lunch hour. If you are getting treated with redness, you're going to come in and come out with rosy cheeks or redness in the areas that I treat. But if you're coming in for browns, the downtime is more so, those browns are going to begin to darken and turn into speckles, and then over about the next 7 to 10 days, they're going to flake off. You can put on makeup immediately after this treatment. So I have people, the only thing you can't do immediately after this treatment is go work out because you have heat under your skin, and we need to let that cool. So we say, don't work out till the next day. But other than that, you have no other restrictions. You can go right back to work. You can put your makeup on, you can put your lipstick on, you can put your eye mascara on, and go right back to work. We also do this treatment to the body. Again, sunbathers out. We all have those brown spots all over us. This is a client who I did this treatment. What you're seeing on the left side is that's about 3 days after her treatment. So that's the browns all coming out and turning darker. And then the next picture is about 3 to 4 weeks after her treatment, okay? So when I do the treatment, I treat that whole area. Those brown spots are dark, but they're not that dark. And then they darken, and then within a couple weeks, they flake off, okay? There's no pain to the flaking. There's no peeling to the flaking. It's honestly, one day you notice that they're dark, and the next day you don't have any darkness, okay? This is that skin brightening peel again. So you're seeing just overall hyperpigmentation in the face from sun damage, and then the brightening of the skin. Moxie, so a Moxie laser, as we mentioned before, because it is a resurfacing, it's going to go a little bit deeper, and you're going to have a little bit more downtime. The downtime for this is about a 7 to 10 day downtime. Does that mean you can't leave your house? Absolutely not. Most people aren't even gonna know that you had downtime. If you are concerned about people seeing you with your face a little bit red, then I say do it on a Friday, take Saturday off, by Sunday you can go to the store, okay? It's really very quick, but there can be some redness and swelling for a couple days after it. After that, it basically looks like you have a suntan that begins to flake off for about a week. But I had mine done on a Saturday. On Tuesday, I went to the dentist. They're right up in my face, and I said, hey, my face looks weird, sorry, and they didn't even notice, okay? I could feel it, it was dry and it was flaking, but they didn't notice. And speaking of my before and afters of my Moxie, that's me before, after, one Moxie. I had to wait 6 weeks to get my final results, so those pictures are taken about 6 weeks apart. And then the halo. The halo is going to be deeper, and it's going to do more resurfacing than a Moxie or a BBL. So if you have significant wrinkles, significant damage, or you just don't want to do as many treatments. BBL, the recommendation is 3 to 4 treatments. Moxie is 2 to 3 treatments. If you just want to bang it all out with one treatment, the halo's the way to go, okay? You're going to go a little bit deeper. It is actually going to remove the skin, not all of it. It's going to remove a percentage of the skin during the treatment, depending on how much resurfacing you need. And then it's also going to stimulate deeper heat and deeper tissue growth. So this is a hybrid fractional laser and is the strongest laser that we have. And we can custom it for what you need for your concerns, okay? But here you're seeing improvements with skin color, redness, and texture, okay? And then the Pico laser. These are those brown, crusty things that we see and are annoying. I would say this is a more extreme case because they were raised and brown. This is after 2 treatments. Obviously, we're not done. We have to do a couple more. The bigger they are, the darker they are, the more treatments it takes to get rid of them, okay? If it's flat, and you can see on the right-hand side, right upper hand side, that some of those are completely gone. Well, those were the ones that were flatter, and we got to the base layer with the first treatment. The ones at the bottom were a little thicker and a little darker, so it's going to take multiple treatments for them to get rid of, okay? So if you go in and you have someone say, or you go and you say, how many is it gonna take? How many treatments is it gonna take? Well, we can only give you what we know, and that is the thicker it is, the more damage you have, the more treatments it's gonna take. This is a hand. We always say, don't forget about your hands. Don't forget about your face, or if you're doing your face, don't forget about your neck and your hands, because those are the 2 other places that people are looking at all the time, especially if you talk with your hands like I do, okay? So this individual came in actually for a BBL, and we could not get all of her browns off with a BBL, so she came back in to use the Majesty Pico laser, and we're able to get some of those more stubborn ones off. Can she use a couple more? Are we finalized with that treatment? No, we can always go back in and hit and remove the ones, but we are very happy with what we got so far. And then the clear V laser. This is probably our hidden secret that we just, it's amazing. I have clients coming in who have had, many, many different kinds of vein treatments in their history, and they've never had results like this. And the reason is after the treatment, it continues to get better for 3 to 9 months after your treatment. And then you go to a period of time where there's barely anything there. And honestly, a lot of my clients haven't had anything come back yet. And I look at my coworker here because she was the very first one we treated with this machine, and hers hasn't come back yet. And it was probably 3 years ago. Yeah, I mean, very exciting when we get a piece of equipment that, they say works, but, you want to test it yourself. You want to make sure that you didn't just buy a big, really, really expensive piece of equipment that's not going to help people. So we're very excited. We have had amazing results with this procedure. It is spicy. I'm not going to sugarcoat that. If you have large vessels, it doesn't feel great, but I've done it to myself. So if you can do it to yourself, then it can't be that bad, right? And then here's another one before and after. And again, these are just one treatment. Typically with vessels, the bigger it is or the more vascularities you have, you're looking at getting your best results between 2 and 3 treatments, I typically tell people. And we space those about 3 to 6 months apart, okay? Because it will take a few months, as you see with the 3 months later, that she still has a little bit of hyperpigmentation from that first treatment. So I tell them that's about the time that I would want to do a second treatment. But I want, there is a period of time of healing where it gets red, and then it gets a little bit hyperpigmented, and then it completely goes away. Meaning the hyperpigmentation goes away. Hopefully a lot of the vessels go away. But then you would come back in and we'd do another treatment. We'd go through the process again. All right, treatment for laxity and fine lines. Now, I don't know about you, but I remember sometime in my 30s looking down at my knees and seeing the wrinkles above my knees. And that was just like, oh, okay. So we do these things to not just your face, not just your neck. We do them to the back of your arms if you needed it. We do it I've done it to an abdomen, a pregnant abdomen, or not pregnant, post. And I've also done it above someone's knees where those wrinkles are. So microneedling, that's just the basic microneedling with a pen. RF microneedling, that's using heat and radio frequency to get deeper into the tissue to stimulate those fibroblasts. And then, as we've already talked about, the halo and the moxie and chemical peels, okay? So I use this as my before and after. This client was super funny. She's like, I think there's been benefits, but I don't really know. And I said, well, I have your before pictures. Let's get pictures today. She had a completely new jawline with 2 treatments. And she had a third one on her account because we sold it in a package of 3. And she's like, I just don't know if I want to do my third. I don't know if I've seen it. And I was like, humor me. Let's get some pictures. And I showed her these, and she was like, all right, I'll schedule my third. That's pretty awesome. And I have a few like this. Now, these, because you're stimulating collagen growth, because you're improving the growth of the texture and the tightness of the skin, you're not going to see immediate results with this, okay? This isn't something that 2 weeks later your skin flakes off and you look beautiful, okay? This is something that is a prolonged growth. It is increasing the productivity of healthier tissue that will take about 3 to 6 months post-treatment to grow, okay? So none of these, and nothing that you're going to do to treat other than the halo and the moxie is going to be an immediate gratification. And even when you get a halo and a moxie, those 2 weeks of downtime when everything flakes off, you're still going to have 3 to 6 months of healthier skin growth because of the heat that got penetrated deeper into the tissue. Does that make sense? Okay. Wrinkle treatments, neuromodulators. Neurobotulism toxin A. I joke around with my clients and say, pick your poison, because Yes, I know. That's the big concern, is that we're putting poison into our skin, but we are doing it in such low doses that your body actually metabolizes it, okay? So we're not doing it to overdo the toxins and poison you. We're just doing enough to treat the area that we're injecting so that those lines go away, okay? Hyaluronic acid fillers, that's the filler world, the big lips, the big cheeks, the things like that you see on, but they don't have to be big and they don't have to be noticeable. It could just be replacing what you've lost, okay? And we're gonna see some before and afters of those things as well, because I think that's a big misconception of fillers. People think they're going to look unnatural. And if you're going to a good injector or a good medical spa, you're not gonna walk out of there looking unnatural unless you wanted to look unnatural, okay? Our goal is just to replace what you've lost. Bring back the youthful look. Sculptra is honestly one of my favorite injections. It is a poly-L-lactic acid. It is a biostimulator. So basically what we're doing is we are injecting it under the tissue to stimulate healthier tissue. It increases, within 30 days, it is increasing your collagen 1 by 60%, okay? The production of your collagen 1 by 60%. So that's another injection that you're not gonna see necessarily immediate gratification, but 3 to 6 months out of that procedure, you're going to see healthier skin grow in, and you're gonna see some before and afters. Healthier skin grow in, fuller face in areas where we've lost that fat tissue. And I mean, the healthier means less wrinkles and more hydrated, okay? Protein-rich fibrin, this is where we draw your blood. We spin it down, we get the fibrin-rich plasma out of it. It turns into a fibrin, and we re-inject it onto your face, okay? So it is also, same idea, it is stimulating more collagen growth, improving texture and fullness to the face. And then, as we mentioned earlier, exosomes. Exosomes are something that you can put on topically to help collagen and laxity. I like that. 4 days after 60 units of Dysport in the upper face. Dysport is just another neurobotulism toxin A. It's a brand name. So if you are concerned about wrinkles in your upper face, between your brows, upper face, crow's, things of that sort, the only way you're going to truly treat those wrinkles to not be there is a neuromodulator. We inject the lower face to help thin the face. So when you meet up with your provider, you can talk to them about treating the jawline, the platysmal bands, things of that sort that will help thin your face and make it more youthful. So here's some filler. As I said, it doesn't have to be big. It just wants to be natural. So this is just making her, helping those rhytides around the lips. My favorite is when I have a client that comes in and says, my cheek is at my chin. I need you to put it back in my cheek. So this is a perfect client that basically her cheek was at her chin and we just needed to put it back up, okay? So not looking too unnatural, but just kind of replacing where that heaviness is in the lower face and popping it back up into the upper face. Again, a little bit of lip filler into those lip lines. You don't have to be a smoker to get lip lines. You just get them, okay? Some people get them, some people don't. There's no way to tell. Now, obviously, if you do smoke or you do suck on a straw all the time, they will probably show up faster. But inevitably, we're all going to get lip lines. We talk and we use those muscles. And then Sculptra. So if you notice the texture, I don't know if it shows up as well on these screens, but if you notice the texture of her cheek, this client had actually just recently lost 40, 50 pounds between these two pictures. And so you would expect a significantly more laxity in the cheek area. And surprisingly, because she was doing Sculptra throughout all of her treatments, we didn't get any laxity in her skin, and it maintained. Another fun fact about Sculptra, it actually got FDA approved back in the 80s and 90s with the AIDS epidemic. Because with AIDS, they were losing atrophy in their face, and this was what was given to resupply the face with fat tissue. So the major concerns with Sculptra, well, I think we all know the major concerns with filler is overfilling. Same with Sculptra. If you are not going to a trained injector using Sculptra, you are going to see things written online that say, I look like a chipmunk, okay? And that is the number one concern. Number two being bumps, lumps and bumps, and we'll talk about that. But if you're going to the right person, you're not going to get overfilled. That person understands your face and understands what you need in your face, and not everyone gets injected into the same areas. The goal is basically to resupply the face in the areas that we lose fat and causes that aging look. We use a picture in our spa of an upside down triangle when we're youthful, because our face does this and is all carried up. And then as we get older, it all goes down because we lose all the structure in our upper face that's holding this tissue in place, okay? So the idea of Sculptra is basically re-injecting it into the upper face and the posterior face to bring that face back up into the location that we want it to be, that we had when we were younger. Another before and after of Sculptra is here. This is 4 months after receiving her first treatment. So she received Sculptra comes in, you do your first treatment, and 4 or 5 weeks later, you get a second treatment. So this is 4 months after her first treatment. So this is really, really good. I wasn't expecting a lot to be seen as she was in her 60s. And typically it takes longer as you get older for collagen to grow or to be seen. She was 62 in this picture. And you can see it almost looks like she's had peels, because her skin looks so much healthier. It's smoother and more lifted on the right-hand side. And on the right-hand side, you can really see the pigments improving. So that's all just from those injections that you're seeing that. I asked her if she was using any brightening agents or if she was doing anything. She says, Madelyn, I barely ever wash my face. So that was disappointing, but at least we know she was doing nothing else. Okay, so then we get into hair thinning. Last 2 slides. Hair thinning, we all go through this. That's my picture on the right-hand side. Everything I have on my head right now is fake, basically, and I will always admit to that. But I have a big trouble with maintaining hair on the crown of my head. And so we carry a few different things at our spa. Nutrafol is a very well-studied natural supplement that you can take. It has ashwagandha in it, which is the #1 supplement to promote hair growth or healthier hair. So they offer both a collagen, they offer supplements for men, women, and older women over 45 that is made for you and what you have with your hormones. Then we have the Hydrofacial Ceravive. Oh, and Nutrafol also just came out with a serum that we carry, which I've been using and I love because you can put it on your scalp, sleep with it, and you wake up and your hair's not greasy at all. It's doing its work over while you're sleeping. Hydrofacial Ceravive. So I won't lie, when I saw they came out with this, I was like, right, yeah, I bet it works, kind of thing. Like, I love hydrofacials for my face. They're lovely. But I thought it was a little bit of bohunk to be doing it to my scalp. Well, during shutdown 2020, we did a treatment to my scalp, and I had 5 weeks to use the serum that you get to take home with. Whatever, I'm not going to be able to say it. Take home with you. And so I used it every time I washed my hair, which is about every other day to every third day. Massaged it into my scalp. And what you're seeing in these pictures is me right out of the shower, 5 weeks apart from using that serum and getting that treatment. And I was flabbergasted. I was like, how could something so enjoyable and so easy, because it feels like a head massage, actually work? And it does, and it's awesome. So basically what it's doing is it's promoting healthy scalp tissue, which then promotes healthy hair growth. Okay. Then you have the PRF and the exosomes. So that's, again, where we draw your blood. We spin it down, get the plasma and all the growth factors out of it, and re-inject it into your scalp. Okay, this is being done and has been done for decades. I get men all the time sent from Bosley in Des Moines to come to my spa to get their scalps injected. It's not the most comfortable, but I always tell people we're gonna get it done fast and it's gonna be as painless as I can. And so what you're seeing in the before and after pictures right next to that is 3 or 4 injections, because that's what we recommend, 3 to 4 injections a month apart. And then you will need maintenance, so maybe 1 to 2 maintenance a year of PRP injections to maintain scalp healthiness, or the use of a serum that's going to help keep hair growth. And then unwanted hair, we already talked about those little whiskers on our face or everywhere else. So dark hair, whether it be black, dark red, brown, anything that's dark, we can use the BBL to laser off. And then the other option is dermaplaning. Dermaplaning is not only shaving your face with a straight razor, it is actually removing your dead skin cells as well. And no, your skin will not, or your hair will not grow back thicker. That is a huge, that is wrong. It will not. I can tell you how many dermaplanings I've had in my years, and it's never grown, I've never gotten a beard, okay? Hormones are really the only thing that's going to stimulate hair growth onto your face. So when we talk about laser hair removal, we always say it's about 4 to 6 treatments. But if you're going through perimenopause or you're going through menopause, it may fluctuate because new hair is growing. As much as we want it to or don't want it to, it's going to happen. So I tell youth, because I have some people that will come in with their teenagers and say, oh, we need to do something. She's getting ingrowns all the time. Can we treat her hair? I say, yeah, we can, but it's not going to just be 4 to 6 treatments because you're going to have so much hormone changes in the next 10 to 15 years that her hair is going to keep growing, okay? New follicles are getting made. So that, yes, we can. We can do that. It helps immensely with, I wish I had this option and it was there. As we always talk about, our parents didn't really talk about these things with us. But if I would have had this in high school and college, it would have been a whole new world. I was a track runner. I wore those short shorts. It was not ideal. It would have been great if I had the laser hair removal. And then dermaplaning, it's just a lovely, relaxing treatment for me, so. Questions? Yes. So she asked if we use numbing agents. Yes. On some treatments, we do. We don't use it for the BBL because there is a fine line between treating and burning. And so we need your response back to us to give us an understanding of where you are with your discomfort. We want it to be tolerable. We don't want it to be too hot. So we ask you, how's this feel? Does it feel okay? All right. And there's a little bit of pushing, but we want you to be able to tell us. Now, with a Moxie and a Halo and an RF microneedling, yeah, you're gonna get numbed. You're gonna put numbing 45 minutes on, a topical numbing, on 45 minutes prior to your appointment. And I always explain to a lot of my clients, it will prevent a lot of sensation, but it's not gonna prevent all of the sensation. You're still gonna be able to feel little pricks and things. And some people tolerate or not tolerate, utilize lidocaine better than others. Some people, lidocaine will completely numb their face for hours upon hours upon hours. And then other people, you could give them the world of a lidocaine and it only maybe takes back the pain a little bit. Unfortunately, I don't know what you would be or what anyone would be until you start the procedure. And then we just work with each other through it. So I've done every procedure. And there are ones that are spicier than others. So if you're one that you come in and you're like, I have no pain tolerance. Okay, well, I'm not gonna recommend this and this and this. Let's start down here, and that's fine. But yeah, if you do have a good one, you'll be fine.
How do you, when people
The answer to that, yes. Absolutely. So at our medical spa, we have 1 hour free consultations that you can set up with me. There are 3 nurses at our facility, and then we have 2 estheticians at our facility. And we do 1 hour free consults, and we'll walk through your skincare regimen, what you should be doing, and then also treatment regimen and maintenance regimen, okay? So as I said, it's not the same for everyone. It is really specific for what your concerns are. Over here, I have a bunch of pamphlets of different treatments that I talked about, as well as our price sheet, as well as my card. And so, grab those, ask questions. Yeah, it's really easy, and our place is very welcoming. I think that's what we get told the most is coming into our spa is it's not intimidating. I'm a big dork, so I'm typically loud and you can hear me, and that's not the spa atmosphere. But my clients know me for that, and so I'm, come on back. We sit and we basically have coffee together and we talk and figure out what the plans are. And I know way too much about everyone's life, and they know way too much about mine. Any more questions? Cool. Awesome.